Good day everyone, my name is Richmond Jasper Robles from St. Augustine School of Nursing, Las Piñas Branch. Today we're going to demonstrate the four main vital signs: temperature, heart rate, respiratory rate, and the blood pressure. By checking a child's vital sign, one can determine whether the child is feeling well or not. If he or she has a fever, then the caregiver will take necessary measures to keep the temperature under control. It is also important to check the child's pulse, respiration rate, and the blood pressure. This will confirm the general impression of a child's condition. Body temperature can be obtained using a thermometer. There are several places you can take somebody's temperature, like the ear, the mouth, the axillary or the armpit, and into the anus. There are also several types of thermometers you could use. There's the classical, the digital, and digital ear thermometer. For this demonstration, we'll be using the axillary or the armpit and a digital thermometer. Before taking a temperature, be sure you have the following materials with you: digital thermometer, cotton balls, alcohol, and a child's record book. Now, let me introduce to you my participant. Hi, my name is RJ. What is your name? Sam. How old are you? 11. Sam, is it okay with you if I'm going to take your vital signs to make sure your body is healthy? Yes. First, we'll be performing a hand hygiene using an alcohol. Assist the patient or client into a sitting position. Sanitize the thermometer using cotton ball with alcohol. Wipe the thermometer with cotton ball from the bulb to the stem in a circular motion. Throw the used cotton ball into a trash bin. Place the tip of the thermometer in the center of the armpit. Tuck the child's arm snugly against the body. Leave the thermometer in place for about a minute or until you hear the beep. Now, remove the thermometer and read the temperature and record it. Sanitize it using cotton ball with alcohol. Wipe the thermometer with a cotton ball from stem to the bulb before returning to its case. Throw the used cotton ball into a trash bin. Pulse rate is a measurement of the heart rate, or the number of times the heart beats per minute. As the heart pushes blood through the arteries expand and contract with the flow of the blood. Taking a pulse not only measures the heart rate, but can also indicate the following: heart rhythm and strength of the pulse. As the heart forces blood through the arteries, you feel the beats by firmly pressing on the arteries, which are located close to the surface of the skin at certain points of the body. The pulse can be found on the side of the neck, on the inside of the elbow, or at the wrist. For most people, it is easiest to take a pulse at the wrist. If you use the lower neck, be sure not to press too hard, and never press on the pulse on both sides of the lower neck at the the same time to prevent blocking blood flow to the brain. The respiration rate is the number of breaths a person takes per minute. The rate is usually measured when a person is at rest and simply involves counting the number of breaths for 1 minute by counting how many times the chest rises. Respiration rates may decrease with fever, illness, and other medical conditions. When checking respiration, it is important to also note whether a person has difficulty breathing. The normal heart rate or pulse rate for a 5 to 12 years old is between 70 to 120 beats per minute, and the respiration rates ranges from 18 to 30 breaths per minute. Before making this procedure, you have to make sure that you have the proper materials with you. You must have the wristwatch, preferably with the hands or an analog watch, alcohol for sanitation, and the child's record book. First will be performing a hand hygiene using alcohol. Position the client appropriately in an upright sitting position, resting the left arm beside her at her heart height with her palm facing upwards. Using the first and second fingertips, press firmly but gently on the arteries until you find the pulse. Begin counting the pulse when the clock second hand is on the 12. Count the pulse for 60 seconds. When counting, do not watch the clock continuously, but concentrate on the beats of the pulse. For taking the respiratory rates, without removing your hand, observe and count also for the respiratory count and pattern of the rise and fall of the chest, shoulders, or abdominal area. One rise plus one fall is equals to one breath. Be sure your client doesn't realize you are already counting their respiratory patterns. Then record it. Blood pressure is the force of the blood pushing against the artery walls during contraction and relaxation of the heart. Each time the heart beats, it pumps blood into the arteries, resulting in the highest blood pressure as the heart contracts. When the heart relaxes, the blood pressure falls. Two numbers are recorded when measuring blood pressure. The higher number, or systolic pressure, refers to the pressure inside the artery when the heart contracts and pumps blood through the body. The lower number, or diastolic pressure, refers to the pressure inside the artery when the heart is at rest and is filling with blood. When taking a blood pressure, be sure you have the proper materials with you. Alcohol for sanitation, child's record book, stethoscope, and a manometer. Manometer is an instrument which measures the blood pressure. First, we'll be performing a hand hygiene using an alcohol. Position the client appropriately in an upright sitting position, resting the left arm beside her and her heart height with her palm facing upwards. Wrap the deflated cuff evenly around the upper left arm. about 2 to 3 centimeters above the bend of the elbow. And fasten securely. The cuff should be snug but not too tight. Place the stethoscope on the brachial artery until you hear a heartbeat. And close the air valve on the hand pump by turning the screw clockwise. Hold the pressure gauge on your left hand and squeeze the inflation pump with your right hand at a steady pace. It's recommended to inflate the cuff 180 mm of mercury. Release the valve on the cuff to decrease the pressure. As the pressure falls, identify the readings of the manometer. Take note of the systolic and diastolic readings. When you hear a heartbeat, check the pressure reading for the systolic upper blood pressure value. When you no longer hear a heartbeat, check the reading for the diastolic lower blood pressure valve. Deflate the cuff and completely and rapidly document the result.